Patients with certain types of advanced cancer are finding hope in a chemotherapy treatment that's done here in Grand Rapids.
Hipec was featured on tonight's episode of The Good Doctor. It's a newer procedure that many don't even know about. The local surgeon who brought it to Mercy Health St. Mary's explained to me how it works.
I'm Jill Onesti. I'm a surgical oncologist at Mercy Health Physician Partners at St. Mary's. Hipec, which stands for heated intraperitoneal chemotherapy. It's a pretty intense surgery, and our goal with the surgery is to make a large incision so that we can see and feel every aspect inside a person's belly to know if there's any tumor coating any surface. Our goal is to remove every teeny tiny small bit of cancer that's in there, and then after we've removed that, we bring in our chemotherapy. That's part of this machine right here, and that is connected to a patient via an in tube and an out tube so that we can run a complete circuit and put chemotherapy through there to coat every single surface on the inside. This is one of the most intense surgeries that a person can undergo.
Is the chemo heated when it's going through?
It is heated, and that helps the chemo be more effective when it's in direct contact with those cancer cells.
And there are specific patients who are candidates for this.
Selecting the right patient for this procedure is a very critical component for this. The patients that would benefit most from this procedure are ones whose cancer has spread to the surface of different organs and the lining inside the abdomen. And it's very important that we're able to try to get the tumor all out. It's also a lot for the patient to go through, so they need to be strong enough to be able to handle the surgery and the recovery afterwards.
In this specific episode of The Good Doctor that aired earlier tonight, the patient had ovarian cancer and underwent this procedure. Is that something that you would use the procedure on someone with ovarian?
We do use this surgery for patients with ovarian cancer. It's not necessarily standard upfront procedure approach at this point in time. There's a lot of research showing that there are specific patients with ovarian cancer who will benefit from this.
A lot of people don't even know about the procedure, let alone the fact that it's done right here in Grand Rapids.
There's a need for increased awareness. And even in the medical community, not everybody is aware of the benefits.
It's long, it's labor intensive. Like, as you say, the patient has to be strong because it's hours and hours to take to do this.
This is a very long procedure. I usually tell patients to expect anywhere from 6 to 16 hours of surgery. And you can imagine with that much surgery, it is a very long recovery afterwards. And we do everything we can to get the patient feeling back to themselves quickly, but it is quite a process.
And so why would a patient want to do this?
For most patients, this type of procedure is something that, depending on what they have, can either offer a cure or can offer additional time for patients who don't have many other options. And that is what is so critical about Hipec.
When a patient does have this procedure with advanced cancer, has it been able to at least prolong their life if it doesn't cure them?
The studies have shown that this offers patients more time than either chemotherapy alone or traditional surgery and traditional chemotherapy would have.
If someone's watching this and they either know someone or they themselves could possibly be a candidate and didn't know about it, what should they do?
We absolutely encourage people to reach out to us or to any other Hipec surgeons close to them and just get information.
How is it for you to be able, to have this the stamina to do it and then to see the results with the patients?
Well, during surgery, you are so focused on the patient, you don't feel anything else. You're not hungry, you don't have to go to the bathroom, you're not tired. And to see somebody recover, to see somebody have years and years of feeling good, that is just so rewarding, and we celebrate that victory with every patient that comes in. I knew this was a program I wanted to start at St. Mary's because there's such a need for it in our community, and I wanted to be able to tell people there is still hope and we can do something for you.
Surgeons from around the state who do Hipec are in the process of forming a collaboration to share information on how to help patients here in Michigan. And there's more information about Hipec on the Mercy Health website. You'll find that in this story on our website, 13onyourside.com.